You're listening to the Westminster Canterbury Tales podcast, creating community to foster joy and well-being. Thanks for listening.
This is Cannability Consulting, and we're here to tell you a little bit about who we are and a little bit about our background. So I'll start with myself. I'm Dr. Tori Crenshaw. I'm a geropsychologist, and I've dedicated my life to adults and older adults and quality of life and improving that for them. And one of those ways that we are doing that is through Cannability Consulting. Let me turn you over to Alex. Dr. Hill.
Hi, I'm Alex, or Dr. Alex Hill. I am a nurse who is also a doctor of nursing practice. I've made it my life's work for the past 3 years to really become a subject matter expert as much as I can be on medical cannabis, cannabinoids, and cannabis therapeutics. I've been a nurse for about 11 years now, specializing in older adults. I'm board certified in gerontology and nursing professional development, and have done a variety of things in the healthcare space and have really enjoyed bringing my passion for learning, for medical cannabis, for regulatory compliance, and so many other things all into one to help folks optimize their human endocannabinoid system and get well in a different way.
So, Dr. Hill, if I were an individual that came to you for some consulting, what would that look like?
Sure, I'll walk you through the consult journey. So you'd reach out to us either by filling out a contact form on our website or sending us a message on social media, giving us a call. We would then contact you to determine the best services for you. We really tailor our packages to the needs of your preferences, your goals, your previous experience with cannabis or hemp, and figure out a plan that will work best. Once we decide what that looks like, I will send you an intake questionnaire electronically that you'll fill out a few days prior to the appointment. And then I take that information and compare it to the current science and evidence related to your health condition, also taking into your values, your preferences, and your needs, put all of that into a written plan that includes lots of educational references that you can refer back to and that we'll go over in detail during our consultation. And then that plan is either reviewed virtually or in person, depending on what works best. And you're encouraged and welcome to bring a caregiver, a spouse, or a support person who wants to learn more. And then from there, we figure out when we are going to follow up and check in to see if we need to make any adjustments or tailor the plan accordingly.
I know I probably made a big jump there because there's like baby steps before that, right? So webinars, education, some great opportunities to learn more about what is the endocannabinoid system, what is it all about? And there's so much research out there. It's just amazing that we have come so far, but we have so far to go. So tell us a little bit about that.
Yes, so that is quite a bit to unpack. I'll start by talking a little bit about the range of services that we offer. So while an individualized consultation is our most popular service, we also do education in a variety of formats. That can be in community events. We can go to community organizations such as clubs or schools, various locations such as that. We also do large lectures in person, both here in our community or in public, and lots of webinars. We're very active in social media, sharing small tidbits. So if you're not already, definitely encourage you to follow us on Instagram, Facebook, Twitter, and now we're actually working on a LinkedIn page as well. Some other services that we offer is care navigation. So if we need to talk with a healthcare provider that you're currently working with that needs some help, we also support businesses and organizations that support you. So as an example, if you live in an assisted living community or a skilled nursing community, or you're receiving care in your home privately, we can help healthcare providers and those that are helping you understand more about the human endocannabinoid system and how to support you. We use evidence-based literature to guide all of our services. We abide by state and federal laws, and we teach you how to do the same. So it's really our goal to empower you to take charge of your wellness by understanding what your endocannabinoid system needs and how you can upregulate that endocannabinoid tone. And believe it or not, it might not even involve cannabis or hemp at all. It could simply be a change in diet or other things which we're able to help with as well.
So everyone should have this opportunity for this high quality education. And I know we offer lots of virtual education also with great response. I think we've had probably almost 100% conversion from attending the webinars to saying, I want an individualized consultation that we can talk about what's going on with my system and how I help to balance that.
Yes, I think when people learn that the endocannabinoid system exists and why and how it's been deficient for so long, it's really eye-opening. It gets people very curious, hence why we typically call our most popular webinars called Curious About Cannabis.
So Cannability Consulting, is that something that is out there in this area? Because as we got started, I really didn't see anybody else doing education. It was a lot about products and what people were selling, which we're not producing and selling. We're trying to help individuals, give them the knowledge to have the ability to make good choices for themselves.
Yep, that's right. So while we can help connect people with reliable products that have the appropriate testing and labeling and all the things that we're really looking for in a safe product, what we are really here to do is to provide a service of support, care, navigation, and education. So yes, it's very different and unique to this area. And so we're really excited to continue to spread the good word as much as we can to everyone and help them learn. So Tori, can you tell us a little bit about how we got here? I'd love to hear from your perspective.
Wow, when you first came and said, I'm going to continue my graduate studies and I want to get a doctorate in nursing, what should I be studying specifically? And I said, Alex, what are you passionate about? And when you said cannabis and your face kind of glowed, I said, here we go. The journey is starting. And so just all of the research that you've done and you've brought back really incentivized me to learn more about cannabis. So very passionate. Your passion has rubbed off on us. And then we brainstormed and said, let's offer an educational opportunity to individuals and can't be called cannabis. So what do we call it? And I said, how about cannability, the ability to really get more information and use cannabis in a safe way and empower individuals to do that for themselves. So that was the start. Here we are. We've gotten in front of a lot of people across the country. You've done a lot of conferences, and I've participated with those also in the medical field and individuals. And there's so much excitement out there. There's so many people that are suffering, that are on many medications, having all kinds of side effects, and they're just done. They want an alternative. And this has just got so much promise that we had to do it. We didn't have a choice. It's now my passion too.
Absolutely. Yep. Cannabis is growing literally and figuratively, whether the general public wants it to or not. And I think we've really identified that the access is growing, but the access to knowledge and understanding really what it is that you're consuming and how it can help you is really the gap that we're trying to fill and that we are filling. And so we're excited to see what happens next.
All right. Hope to see you in our next podcast.
We hope you enjoyed this episode of the Westminster Canterbury Tales podcast. Thank you for listening.